Welcome to the Simplified Integration Podcast. This is episode number 21, How Regenerative Medicine Fixed My Knee.
Leonardo da Vinci once said that simplicity is the ultimate sophistication, and I agree. You see, the problem with the way that most consulting groups approach medical integration is anything but simple. In fact, it's the exact opposite. It's expensive, it's complicated, and quite frankly, it's exhausting. Enough is enough. There are far too many amazing integrated clinics that are struggling. Well, I'm on a mission to change that. What I've come to find from over 5 years working with integrated practices is that simplicity really is the secret. The old saying of less is more is true. Through a streamlined approach, I was able to create multiple successful 7-figure integrated clinics, and now I'm going to show you how you can do the same. Join me as I share with you the secrets to successful medical integration and practice growth. Join me on a journey to greater sophistication through innovation. I'm Dr. Andrew Wells, and welcome to the Simplified Integration Podcast.
Hey, what's going on, Doc? Welcome back. It's great to have you here on the Simplified Integration Podcast. My name is Dr. Andrew Wells. If I sound a little bit different on this podcast, it's because I'm not in my normal podcast studio. I'm actually on a pontoon boat in the middle of Lake Lure, North Carolina. And I'm here because it's actually I'm recording this in the middle of the coronavirus epidemic. My wife and I both work from home, so we decided to come out to the lake and spend our time here because it's a much nicer place to spend a lot of time being quarantined rather than being at home. And we're very fortunate enough to be able to work from home and be in this amazing spot during this really crazy time in history here. So if I sound a little bit different, that's why. If you've never listened or watched this podcast on YouTube, check out my YouTube channel. You can actually see where I'm sitting right now. It's a really cool view. I'd love to share this special place that I get to call a vacation home with you guys to show you where I go to have fun and go to relax. And this is a really, really fun place to record a podcast. I'm just really lucky and blessed to be out here. I hope you can hear me okay. There's a pontoon boat, another pontoon boat actually cruising by right now. So you may hear some boat traffic in the background. There's not a whole lot of boats out here today. But anyway, I want to share with you the story of how regenerative medicine fixed my knee. So I've been a long distance runner for a long time. I started when I was 10 years old. I just turned 40 years old, so I've been running long distance for about 30 years. So that's 30 years of hard impact on my joints. So about 5 years ago now, I was working out in our office, and we used to do these Wednesday night workouts where we'd have patients come into the office every Wednesday night and we'd work out together. I'm going to pause here for just a minute because there is a ski boat going by right now. It might be hard to hear me. I don't know how much that boat traffic noise is coming through the microphone, but I'll wait. All right, cool. Anyway, it is a gorgeous day. It's sunny. It's the end of March, and it's about 80 degrees here on the lake, so it's a really fun, nice time to be here. But anyway, I was working out in the office. I was jumping up and down doing burpees. I landed on the ground. I felt a pop in my left knee. Didn't really hurt so much, but my concern was, oh shoot, I just tore my meniscus. And so I didn't think much of it. I was hoping the pain would go away and it would heal. I had like a dull pain in my left knee. After that injury, I couldn't quite flex my knee all the way, but it wasn't really painful. I could still work out, I could still run, but it was just a nagging pain that was there, and it never resolved itself. So this was around the same time we started, we introduced regenerative medicine into our clinic. And I'd always wanted to do it, and I never got around to actually doing it. So, we'd helped a lot of patients with their joint pain. And then one day, I got a call from our doctor, and he was getting ready to inject the stem cells into one of our patients' joints. And so he had the amniotic tissue thawed out. It was ready to inject, and he was looking back at the patient's information, and he said on his information he had listed that he took a turmeric supplement. And the doc said, well, how much turmeric are you taking? And he goes, oh, I take a lot. And it was actually like a therapeutic dose of turmeric. So he's taking these really, really high levels of turmeric, which you probably know is an anti-inflammatory. And when you're doing regenerative medicine, you want to be off of your anti-inflammatory medications because you need inflammation to help your body heal. And so right before the doc was going to do the injection, he's like, nope, we can't do it. You need to be off your turmeric before we do this injection so that you get the best results. So here's the patient sitting here, totally bummed out because he couldn't have his injection. And we have this vial of cells ready to be injected. And the doc's like, well, we can do two things. We can either throw these out or we can use them on ourselves. And so I raised my hand and I said, yep, put those cells in me, doc. And so he did the injection in my left knee. I didn't feel a whole lot of change in the beginning. It did feel like there was a little bit less inflammation, but a couple days went by, no real change. A couple weeks went by, maybe felt a little bit better. And then about 4 weeks in, I remember I wasn't really paying attention, but I remember working out. I'm like, man, I don't feel any stiffness in my knee. I could completely bend my knee, full range of motion, no tightness, no pain, no inflammation. It was completely fixed. And I never had any knee pain after that. So I went back to running. I went back to working out. Everything was fine. So one of the questions I get from patients is, how long does this injection last? Will it permanently fix my knee? What should I expect? And of course, as a doctor, we never want to be, you never really, in my opinion, want to give, pin yourself down to a time and a date. You don't want to say, oh yeah, this is going to fix your knee forever. You're never going to have knee pain ever again. When the reality is that may or may not be true. And there's a lot of factors that affect it. Your weight affects it, your activity levels affect it, your nutrition, how much sleep you get affects your results, just like any other healthcare therapy. And so for 4 years, I felt great. And so I started running again, and I actually got back into doing ultra marathons. And it was about a year ago, I did this race. It was a 51-mile race on the beach. And it was a grueling race. It was really tough. I really hadn't trained a lot for it. I wasn't really prepared for it. And I ran the race, and mile 30 or 35, I started to feel a lot of pain in my left knee. And I'm like, oh, this is not good. I hope this goes away. Maybe it's just race day related. It's just, I'm running 50 miles. So after the race, I was totally wrecked. My body was destroyed. This is the first time I ever felt old in my life. And, my whole body was sore and stiff, including both of my knees. And I remember hoping and praying that, once I recovered from the race, that the knee pain would get better. And it didn't. It actually, my left knee went back to feeling like it did before I had the injection. And so knowing that my torn meniscus was just acting up again, I had another regenerative medicine injection, and now my knee pain again is completely gone. And so for me, it lasted 4 years, and the thing that set it off again was a 51-mile race. Now, most of your patients are not going to be doing ultra marathons like that, but some of your patients may be overweight, they may be inactive, they may be putting stress on their joints that will aggravate their issue. But for me, I got 4 years of great activity in my knee without having to do steroid injections, without having to do anti-inflammatory drugs, without having to do arthroscopic surgery. So all the procedures and therapies that your patients are used to have probably gotten already. And so for me, the injection, if you're paying cash for this type of injection, sometimes it's hard for a patient to say, $4,000 seems like a lot for one joint injection. However, for me, it gave me, a huge boost in the quality of my life. I didn't have to worry about my knee. It felt great. It was functioning fine, and it did for 4 years. So whatever it did, whether it regrew cartilage, repaired cartilage, reduced inflammation, it worked, and it worked really well. And so you can't really put a price tag on that time that your body's working properly. And I know, as if you're a chiropractor listening to this, I know you know the value of health, because we teach that and we preach that every day in our practices. So you can't put a dollar amount on it, but I can tell you from experience, from someone who not only teaches this, but also as a patient, I had amazing results with regenerative medicine, and it's going to be a part of my lifestyle choices till the time I die. Some of you know I was also in a really bad car accident. So I have had 3 fractures in my neck, and unfortunately had to have 2 levels of my neck fused for instability issues. And so as of now, I'm 40 years old. My neck, roughly 2 years after the surgery, my neck is fine. I don't have any pain. I have no stiffness, a little bit of loss of range of motion, obviously. But right now my neck is doing really well, and I want it to stay that way. So as part of my plan as I get older, I will absolutely be doing regenerative medicine to make sure that my neck stays like it does. It gets better and doesn't get worse over time, because I don't want to be like all the hundreds of patients I've seen with neck fusions that are in pain, have numbness and tingling and neuropathy down their arms and hands. So anyway, guys, I want to share that story with you as a practitioner, as a patient, as a stem cell advocate and regenerative medicine advocate. It absolutely works. It's life-changing stuff. And so if you're listening to this and you have a joint issue, you should really look into it for yourself and for offering this to your patients, because it works. It's a fantastic therapy, and I hope that you and your patients can benefit from it. So hope you're having a great day. I hope by the time you're listening to this, the coronavirus epidemic and scare has passed and we're back to life as normal. But if we're still in the middle of it, keep your head up, doc. Keep moving forward, and God bless. Talk to you soon. Bye-bye.
Hey, innovators. Thanks for listening to the Simplified Integration Podcast. The fact that you're listening tells me that you're like me, someone who loves simplicity. And the truth is, those who embrace simplicity are some of the greatest innovators. So I hope you got a ton of value from what we covered on today's episode. Be sure to subscribe and share with other docs that you feel could benefit from greater sophistication through simplification and innovation. If you've got specific questions that you'd like answered on this podcast, or you've got specific topics that you'd like me to discuss, just shoot me an email at info@integrationsecrets.com. That's info@integrationsecrets.com.